We were obviously concerned about the negative effects when we went through the research material as well as material shared by Swiss Medica, and we were comforted by that. We are happy because so we got all our questions answered. I felt that the clinic was also very clean and quite well organized. So I can't wait to see how it turns up. I hope to see some improvement in things, and any improvement we will feel proud and glad about it.
Can you please tell me where you're from and what brought you to the clinic?
So I'm from India, and I was looking at speech therapy and other things for my son who is likely to be on autism spectrum disorder. He's 5 years old. And while we've been trying all the other conventional therapies, I also wanted to explore to do something more, and that is when I discovered this stem cell therapy. We've done some research online on a couple of places where they are offering these services, stem cell therapy services, and that is when I've encountered your YouTube and your online presence, where we've discovered more. We've contacted a consultant, and that is how we've come to know about you. And we felt that after weighing the pros and cons and other things, then we've come to a decision to take the leap forward and come over here all the way from India.
Okay,
Yeah.
and what specifically have you heard or have you seen in YouTube videos or when you did a research about stem cells that you decided to try?
Right. So when we were casually looking at all the options, so we spoke to doctors there as well. Some of them were it's still experimentative, it's still experimentative, and therefore we can't vouch for it or against it. So they were of the neutral opinion, some of the doctors there. And when I discovered more, and after watching the videos as well as listening to other doctors from Swiss Medica and all, but outside as well, when I looked at it, it felt that there could potentially be upsides, whereas the downsides are almost negligible. So that is when I made a choice, to take the leap forward and give it a try.
Did you have any fears, concerns about trying stem cells and flying to probably unknown country and to unknown clinic for you? I mean, you've never been
Right.
there, so it was quite, I think, scary.
Right. So instead of we were obviously concerned about the negative effects that such therapies that are not widely recommended, by all doctors, 100% of all the doctors. We were widely concerned about it. So that is where I think that was the only concern. And when we went through the research material as well as material shared by Swiss Medica and your team, that is when I felt that after weighing the ups and downs, so we were comforted by that. We were not too apprehensive about having to travel, so because naturally when we feel that when something could benefit our child, that weighs heavily more than any travel inconveniences. So, but we were not worried too much about the traveling and the accommodation. We were, when we spoke to the consultant as well from your side, we were given timely information to questions related to accommodation, treatment, and other things. So that kind of comforted too. It's more the more thing that we had to, the biggest decision for us is that should we opt for a stem cell therapy or not. And once we've done that, the traveling and accommodation and the clinic as such did not bother us too much, given the transparent way that your clinic has shared information with us.
And how did you cope with that worriness about trying stem cells? What did you help you to give it a try?
We were, in my case, my family and I, we were purely dependent on online research data. We've used Google Scholar and other places to look at research papers, where we were broadly looking at conclusions from research. And when we felt that the downsides are quite according to what is expected instead of so that is when we what is expected, in the sense that we had questions like, what, we've heard online comments that there could be epileptic symptoms and other things show up sometimes. So when we looked up and when we consulted more, we felt we came to know that that was only in the cases where the child already has epilepsy. So these are the kind of, by online research and by using Google Scholar and other looking at online information, we felt that the downsides are minimal. So any upside, and we felt that there were positive results in certain percentage of children, especially, after opting for this thing. And it was all a little complicated, but what we could in simple words see is that in some percentage of kids there is improvement, some percentage, and the downsides are limited to already existing preconditions. So that is when we found out.
Okay. And can you please tell me more about symptoms? What are they in your case?
For us, it's in my child's case, it was speech delay. In fact, lack of speech or very minimal speech, and lack of eye contact. These are the primary, lack of eye contact with strangers, not with family members, but with strangers, and speech delay. So speech delay even after reaching 5 years, after crossing 5 years of age. So these are the two primary things. We didn't have any other. So there were also some sensory things like extra attention to certain textures and other things like that. So showing more inclination towards touching certain textures more than others. But apart from that, we didn't have any other symptoms. So once we figured out that there could be some the speech delay coupled with this eye contact, or rather lack of it, with some sensory things, then that is when we felt that it could, potentially be ASD.
Okay.
Yeah.
Can you please walk me through the process of the treatment? How was it for your child?
So the first day when we came here, we came on a Sunday, so we took rest for that particular. We landed in the afternoon. Monday morning we went through a blood test. So the blood was drawn. The nurses and the doctors were quite, they're used to handling kids. So they were, and we could draw blood from his thing, and we went through the tests. And the next day morning, the first procedure included an IV, just like a saline thing from the IV bottle. It is administered intravenously. The first set of stem cells as part of it's mixed with some saline or some other thing, and it's administered intravenously. So they tried to sedate him, and in my case, the oral sedative was good enough. Some cases I was told that they would do another intramuscular injection for sedative before they administered the IV. In my case, the oral sedative was good enough. The child was cooperative, luckily, thank God, and without much of a problem. In 45 minutes or so on Tuesday morning, the first intravenous thing took place. So we, because he was not fully sedative, he was able to, within half an hour or so, regain full activeness after the procedure. And he was under observation for an hour or so beside the doctor's room, or beside the and after that, we spent the whole day at the clinic, and we took a speech therapy session too, but pretty much we spent the whole day at the clinic, going around, having lunch and all. In my case, the child did retain the catheter, I think it's called, so he did retain it. He did not remove it. So we could, in that case, the next day itself, the second procedure could happen. The second procedure would be a very similar procedure, except the type of stem cells administered would be different. On one day it was from umbilical cord, and the other one is from placenta, taken from placenta. And the second day as well, the procedure is the same as the day before, but it was a different type of stem cells. So it's even the second day onward, also mild sedative only. He was not fully sedated. In my case, I saw other kids having to take a deeper, stronger sedation, and they woke up after a couple of hours. But in my case, And we went through the same procedure. It was done in 1 hour. We had breakfast at the clinic after the procedure, and then we attended a speech therapy session, and then we were done pretty much for that particular day as well. So instead of giving a day break between these two procedures, because my child retained the catheter, we could do it in consecutive days without any delay. So that way we were almost done by Wednesday. So Thursday and Friday we were doing some speech therapy, and the clinic was kind enough to take us out on a city trip as well, to take some time off because we had the time. So that was how it was pleasant so far. And everything. So I mean, we're quite happy. We're returning tomorrow. We're quite happy with our experience at the clinic.
Are there any direct flight from Belgrade to India?
So there are the direct flights are very less. So we had to we have a lot more options when we do a layover either in Dubai or Qatar or other Middle East places. We took a brief layover of 3 hours in Dubai.
Okay.
Because we flew Emirates. Okay. If you flew Qatar, you would have a similar thing in Doha.
And how long does it take?
It took us, including the layover, it takes 12 hours in my case. So the flights are for 10 hours. You have a couple of hours of layover in between.
Okay. Okay. And what's your impression about the clinic, doctors, nurses, accommodation, food?
We are quite pleased with the with the doctors. The doctors that I guess patients are assigned at least one doctor who's always talking to them. I mean, multiple times a day. So and we are happy because so we got all our questions answered. Number one, so that already gives us some comfort. I felt that the clinic was also very clean and quite well organized in that sense. So the staff were very friendly. The medical staff, the nurses and the doctors are very friendly. Especially at least one doctor is always available to answer all questions that we have. That sets us. In terms of the support staff and the kitchen, we had 2 times or 3 times meals at the clinic or itself on some days, and the food was good. So they asked us what we would like to eat, so we were given some options. So it's always better when we have options, because we come sometimes from different countries and we have different and kids also, they are used to eating certain things, so they might not like some things. So it was a very it was a good experience, especially it is an experience that lets us focus much more on the treatment rather than having to worry about all the logistics and our comfort. So because those things are taken well care by the clinic.
Okay, and what are the things that you didn't like?
Nothing that I can point of, frankly. I think so far, we are leaving tomorrow. We are on a 5-day program. We are leaving tomorrow, and there's nothing that I can point of. I mean, in terms of there's nothing that I can point of that I can. There's always areas to improve, but nothing I can specifically point out.
What else I would like to ask? Did you have any problem with communication?
No, we had English speaking staff. I think the doctors and nurses spoke English, and the primary person in this case, we are talking, Anastasia from the clinic, who was handling logistics, also spoke English. So that way we did not have any language problems. With the support staff and with kitchen staff, we had to use the Google Translator. But I would say that overall it's a smooth process. Primarily what matters is that the doctors and nurses spoke English, and so is the person coordinating our trip. So that is good enough for us. Yeah.
Are there anything you would like to add, to share with us?
I would say so far the experience has been good. It's just that I'm looking forward to what more, to seeing the results, and or to hoping for an improvement, hoping that And so we are also trying to put more effort in the coming months, trying to encourage the child to do more of speech therapy, more of speaking and prompting and simulating. So I can't wait to see how it turns up. I hope to see some improvement and things, and any improvement will be gladly, we will feel proud and glad about it. And we can't thank the clinic enough for its role.
Did doctors tell you something about expectation? When you should expect, and what specifically? Probably they tell you something about it.
Yes. So before we flew here, we had an online meeting with a consultant, and the consultant doctor told us that after listening to our description of what the child does, as well as after taking in basic data like age and everything else, the doctor did say that in our case there is a chance of 25% chance or something like that of seeing some improvements, because the child was already has some basic level of comprehension, plus was able to read some things, do some basic writing and things like that, even though he was non-verbal. So depending on the child's profile and depending on whatever we told the doctor, as well as the data that we submitted before flying in here, so the doctor was able to tell us something which gave us some confidence to take the leap forward.
Mm-hmm. And did they told you when should you expect some kind of improvements? Like immediately after the treatment, during the treatment, or
we were told around 3 months. 3 months is when we could,
Okay.
We were told that within the first 3 months, first month or so, it's better to put a little bit more extra attention on the kid.
Mm-hmm.
Because but around 3 months is when we were told that there could potentially, most kids who show improvements do so at that time period.
Okay. And probably the last question, have you considered different clinics among Swiss Medica?
Yes, I think we considered one clinic in Mumbai as well, but we tried to compare the types of stem cells that is being administered. We used that as one condition to evaluate what type of stem cells they were using and which ones we felt, based on our online, suited well. So in our case, for some reason, that clinic was also so busy, it was hard for us to get dates in the near future. And in this case, in Swiss Medica, in this clinic, we got a date much quicker. And we were also, the type of stem cells that are being administered here are also found out to be a lot more suitable or compatible for the type of development that we would like to see our child go through, or his condition, suitable to his condition based on our research. Some people were using stem cells from bone marrows, stem cells from some other things and all, right? So because there are different types of stem cells, right? So that, as well as the availability. So we had a relatively early slot here, and we didn't want to delay too much. Once we decided, we didn't want to delay too much.
How long did it take from getting know with Swiss Medica to
40 days in our case.
Sorry, how much? How long?
So in our case, once we got to know about Swiss Medica, it took us around 20 days or so to make a decision, to talk to the consultant and for us, because we are also working, sometimes we don't have the whole day. After 20 days, we then immediately made up our choice after we consult, because we were also waiting for one other clinic to give us the dates or something. And when we decided to go with Swiss Medica, and within 20 days we are here. So it took us 40 days from finding out information until landing here.
And it's quite interesting. How long did it take from got acquainted about stem cells and to coming to Swiss Medica? Approximately.
Around 40 days, 45 days, that's it.
Okay.
Yeah. We moved quite quickly. I mean, we first encountered it 1 year ago, 1.5 years ago, but then the doctors that we spoke to were not very sure. They were giving a neutral opinion about stem cells because one of the doctors said that there are no downsides now, but we do not have long-term data. So what would it look like? 10 years later, we would not know. So that kept us away. So that was our first exposure 1 year ago, and we put it on the back burner. We moved on, and then once again we tried. As 1 year passed, we were naturally a bit more anxious about improvements and other things. So that is when we said, let's relook at all the other options. And then once we once again looked at stem cells and we discovered this clinic, within 40 days we made up our mind and we are here.
Okay.